Well, we see them advertised regularly on TV, medical treatments for fibromyalgia. Do you find yourself asking, what is that? And why haven't I heard of it except for in the commercials? Well, here to shed some light on that disease is Dr. Elliot Rosenstein, Director for the Institute of Rheumatic Autoimmune Diseases at Overlook Medical Center. Well, that's a mouthful.
It is.
But you deal with some very serious issues. Talk about this fibromyalgia. What is it?
Well, it's a poorly understood condition which has finally come into its own. It's a condition that causes widespread pain. It's usually associated with fatigue and sleep disturbances. It may be what our parents or our grandparents spoke of as rheumatism.
Interesting. So is this something that affects older people or is it across the board?
Across the board, even children can get it, but it's primarily younger women.
Wow. Now, how do you diagnose this? As I understand, there's no real test for it.
That's one of the problems. There is no x-ray, there is no laboratory test that supports a diagnosis of fibromyalgia. It's really a clinical diagnosis. So when people come to us complaining of this kind of widespread pain here or here, and not necessarily related to any underlying identifiable anatomic disturbance, we think of this diagnosis. And one of the hallmarks of this diagnosis is the absence of inflammation.
So if you're talking about pain everywhere or just in a couple of places, I mean, I'm imagining you have to do a lot of querying with the patient before you arrive at this diagnosis.
It takes speaking to the patient and examining the patient very, very thoroughly to make sure that there is no underlying inflammatory process that's responsible for the pain. And that was one of the problems always with this diagnosis. It was considered kind of a garbage can diagnosis. It was a way to explain people's discomfort, their symptoms, without giving them an accurate explanation for it. But it's really a discrete condition. And as medical technology has improved, we're beginning to come up with tests that actually do show objective evidence of fibromyalgia.
Has there been a debate among physicians because it's so difficult to diagnose?
Well, I wouldn't call it a formal debate, but there's certainly been discussion where some physicians will say it's not a real diagnosis and others firmly believe in it. And I think it shows a little bit of the arrogance and closed-mindedness that the medical community can sometimes have. But there's no doubt in the mind of the people that take care of patients with this condition. It's a very real condition, and technology now has objective evidence of its presence.
Let me ask you this. We talked about the commercials. Have they helped in terms of bringing a public knowledge to this? Very
much so, and in some ways it has, in a backwards fashion, convinced the medical community that this condition really exists. But now that there are medications to treat the condition, we can demonstrate improvement. It's indication that the Food and Drug Administration has endorsed the diagnosis, so it's much more
making headway.
Exactly.
So let's talk about treatment. Beyond the medications, what can a patient do to perhaps minimize some of the impact of this?
Well, that's very important because when you look at the different things that help fibromyalgia, in many ways it's not the medications that should be emphasized. So it's establishing a normal sleep pattern, getting into a routine where you try to go to sleep at the same time and try to eliminate the disturbances that might interrupt sleep. It's doing regular exercise, in particular aerobic exercise. It's relaxation techniques. Sometimes we suggest cognitive behavioral therapy for our patients.
Those are all things that sound like regular things we all ought to do. Get more sleep, exercise, eat right, you know.
And I think all of them are good for overall health, but they seem to be particularly helpful for people with fibromyalgia.
Now, in terms of the medications, are there those that perhaps have very few side effects that people can take on a regular basis, or is this something that has to be analyzed and overseen very specifically?
Well, for the most part, the medications are safe, although every medication has potential adverse effects. But these are medicines that generally one can take on a regular basis. They fall into two different families for the most part. Medications that have effects, some of them are actually antidepressant medications, but interrupt certain neurotransmitter pathways similar to what would be treated in somebody with depression. And the other family of medications are anti-seizure medications, where they're trying to tone down the overactivity of the nervous system.
Interesting stuff. Well, it's called fibromyalgia.
Correct.
And it is real. We thank you for coming on board, shedding a little light on it.
My pleasure.